Okay. My name is Sabrina Copeland, and nursing 102. Click. All right. The biology of blood. The red blood cells, platelets, and most white blood cells are produced in the bone marrow. There's other B and T lymphocytes, which are also white blood cells that are produced in lymph nodes and spleen. They are produced in the lymph nodes and spleen and mature in the thymus gland. Factors of production. Red blood cells is controlled by the body needs. However, they're produced whenever the body needs them. However, normal blood cells last for a limited time. Red blood cells last for 120 days, platelets are about 10 days, and white blood cells last for about hours to days. There are different, each blood cell plays different roles in the body. The red blood cells are responsible for carrying oxygen to the tissues to deliver oxygen to vital organs and tissues. The white blood cells are potent infection fighters. They usually produce if there's an infection on board with the body. Platelets are for blood clotting and for bleeding. So if you're bleeding in the body, they clot in order to plug it. Each one of these blood cells can have blood disorders such as anemia, UTI, and leukemia. You can go ahead and switch. Okay. So question for you guys. What type of cancer increases the numbers of abnormal immature leukocytes eventually infiltrating throughout the bloodstream? Oh, that was easy. Click. Click, 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 click. Keep clicking. Click. Okay. So leukemia defined. Leukemia is also referred to as blood cancer of the body. It's a progressive disease in which immature blood cells become cancerous, affecting the blood-forming tissues, which is primarily the bone marrow and the lymphatic system. It then incorporates DNA structure changes of normal cells, not allowing the normal blood cells to do their normal job, which is the red blood cells, the white blood cells, and the platelets. And then they proliferate and divide chaotically within the body and eventually occupy more and more space. You can go ahead and click. So as you see here, the normal blood cells, which are the platelets, erythrocytes, monocytes, lymphocytes, and neutrophils, which are the white blood cells, and then you see some red blood cells. And then on the leukemia side, a patient with leukemia has abnormal proliferation, meaning that they chaotically divide and they eventually overcome the arteries and they're clogging the arteries up basically. Hold on, I'm ahead of myself. All right, there are 4 types of leukemia with 2 groups further subdivided into the origin that they occurred. They're subdivided into acute and chronic, and then from the origin they divided, which is the myeloid and the lymphoid. The acute is a sudden onset with cancer cells. They multiply quickly, and the survival rate for a patient who has acute leukemia is low. And then there's chronic, which is a slow onset with abnormal cell progressing slowly, and the survival rate for the patient who has chronic leukemia is usually longer. And then is broken down or subdivided into the myeloid and the lymphoid. Myeloid arises from the bone marrow, and the lymphoid has its origins from the organs from the lymphatic system. So with that totaling, there's 4 types of leukemia. There's acute malignous leukemia, chronic malignous leukemia, acute lymphocyte leukemia, and chronic lymphocytic leukemia. With the acute malignous leukemia and the chronic malignous leukemia, the patient usually starts off with the chronic malignous leukemia and then progresses to the acute malignous leukemia. So it goes backwards from chronic to acute, and eventual death is common. These two leukemias are more present in the patient who's of younger adulthood to older. The chronic lymphatic leukemia is those of men that are age 50 and over. And leukemia is mostly present kids do have leukemia, but it's more present in adults who are over the age of 60. You can go ahead and flip. Okay, so not all patients manifest the same signs and symptoms, and with each diagnosis, symptoms are mostly vague and nonspecific. Most people overlook the fact that they have signs signs and symptoms of leukemia because it mimics that of flu. Some of the signs and symptoms are fevers and chills, persistent fatigue and weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, petechiae, excessive sweating, and bone pain or tenderness. Okay, etiology. So exact causes of leukemias are unknown. However, it's been speculated that environmental and genetic factors play a major role. Genetics such as Down syndrome, or I think I read the Philadelphia chromosome, if they have an extra Philadelphia, if they have in their genetics Philadelphia chromosome. Then we have viruses such as HIV, which their immune is already compromised. The previous cancer treatments, such as meds, the different meds that the patient with previous cancer taken, which makes their immune suppressed. Occupational chemical exposure, such as unlit gas, radiation, those who work close to radiation, or electromagnetic energy, and they said hair dyes and smoking as well. Okay, so a patient has recently been diagnosed with leukemia. Which of the following symptoms would a healthcare professional expect to see given this diagnosis? Take your time and read all the questions, guys. Yes, you are correct. Clicking so fast. Go ahead. Go ahead. It's B. Okay, diagnosis. A patient may find abnormal cells resulting in leukemia in a routine blood test. Before symptoms appear, diagnosis is made by using a history, physical examination, complete blood count with differential ordered, and bone marrow studies to rule out other disorders. Treatment. So different types of, depending on what type of cancer you have, what stage you are, the prognosis of it, and your age and overall health status depends on what type of treatment that you'll get. Like I said, acute leukemia treatment consists of chemo and angioplastic drugs. Chronic conditions may use a combination of chemo, surgery, and radiation. Some type of angioplastic drugs that they may use to treat acute leukemia is the cyclophosphamide, the methotrexate, and sometimes they have the Gleevec. And the angioplastic drugs are drugs that destroy the good cells as well as the bad cells, the cancerous cells. Radiation therapy are used as supplements to increase the success of treatment and to decrease discomfort from enlarged organs. Stem cell transplant or bone marrow replaces diseased bone marrow with a healthy bone marrow, and its transfusion of blood may be prescribed to maintain a near normal blood picture. And then they also have the biological response modifiers. Treatment is usually aimed at slowing down the growth of malignant blood cells, maintaining a normal level of blood cells, hemoglobin, and platelets, and managing the signs and symptoms, and meeting the special needs of each patient. Okay, so complications of leukemia. There are many complications of leukemia. The major ones are infections, and abnormal bleeding, anemia, constipation, nausea and vomiting, alopecia, hyperuricemia, and pain. From bacterial virus, infections usually occur from bacterial, virus, and fungi due to abnormal functions of bone marrow. And characteristics of the disease are bone suppression due to therapy, and that's usually with the medications that the patient is taking. Or normal bleeding is due to the low platelet count. Without enough platelets on board, you have a risk of bleeding. And anemia usually occurs because of the disease itself or excessive bleeding from the therapy that's been administered. Constipation, nausea, and vomiting is due to the angioplastic drugs. Alopecia because of the chemotherapy. Hyperuricemia because you want to keep the patient well hydrated. The urine can become acid. And pain as far as the bone pain. Each patient Each patient has different assessments of pain, so you just want to make sure that you're treating the pain for that patient. I wasn't finished. Nursing measures here are to prevent infections and assess for early signs to intervene promptly. You want to assess for platelet counts and prevent trauma to that patient. Keeping the patient well hydrated to impose production of uric acid, and psychosocial needs and emphasizes on adequate diet and excellent mouth care. Click. The healthcare provider is assessing a patient undergoing induction chemotherapy for acute myeloid leukemia. Which of the following will be the most definite sign of infection for the patient? A, a temperature 100.5, a shift noted in the complete blood count, swollen lymph nodes, or redness and swelling at the central line insertion site. Which one? B. Yep. The role of the LPN will likely be limited because you must have an RN. Go ahead. I'm sorry, I got ahead of myself. All right. So nursing intervention is the role as an LPN. Usually with a patient who has any type of cancer, the LPN will not be sorry, I lost my words. The LPN will not be totally responsible for that patient. We usually interfere as far as prevention of infection and just allowing the patient to be comforted and encouraging patient teaching such as like diet and nutrition, smoking cessations, and stuff of that order. So we can prevent bleeding and bruising by using a soft bristle toothbrush, moving around careful to avoid bumping into things for the patient, which may cause bleeding because of the platelet counts being low. We can patient teach on diet. Patients with cancer, you want them to contain a high fiber, low fat diet. You can assess pain as needed. You may want to have, most of the time, that types of pain medicines that they give pain for patients who have cancer is dependent on the intensity of it, but it usually is oxycodone, fentanyl patches. They can give them aspirin, naproxen. Encourage expressions of fears, offer support. You can just be a nurse and just listen to them, help them overcome their fears, or you can offer them support as like having another patient who has leukemia or a different type of cancer. Speak with that patient so that they can help them get over their fears of dealing with the diagnosis of having cancer itself. There's also support groups such as the National Cancer Society that can offer some support. Infection prevention is, like I said, patient teaching. You want to report any temps over 100 and monitor blood count and any other type of intervention such as like a cloudy urine that may specificate that they have an infection on board. Dealing with the radiation, the chemotherapy, and different types of agencies in order to comfort or cure the leukemia. The patient is severely immune compromised, so they have a higher chance of getting infections. You can go ahead and click. Some standard nursing diagnosis for a patient who has cancer. You want to do a thorough health assessment to inform and specify patients' problems that are identified. Some will be risk for infection, abnormal bleeding, anemia, nutritional alteration with severe anorexia and weight loss. I did see that most patients with leukemia have a chance of getting anemia, and that is aplastic anemia, which is when the blood cells don't carry enough oxygen. Increased levels of uric acid in the urine and blood resulting from chemo. Psychosocial problems related to the effect of the disease as well as the prescribed treatment, and fear of dying. And leukemia, once again, is a malignancy cancer that affects the blood cells of the bone marrow, lymph nodes, and spleen. which involves the production of abnormal white blood cells. The cells responsible for fighting infections, with end results becoming difficult for the body to fight infections, control bleeding, and transport oxygen. And that's it. Is that 10 minutes? I was nervous.